Dear students, welcome to Bluepen Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Moving on to another habit which is also seen in children, bruxism. Definition: bruxism is a clenching or grinding of the teeth when the individual is not chewing or swallowing. So it can be classified as diurnal bruxism or nocturnal. So diurnal means it is seen during the daytime, whereas nocturnal during the night. It is also classified as primary and secondary. So primary include daytime clenching and sleep bruxism in the absence of medical cause, whereas secondary is associated with either neurologic, psychiatric or sleep disorders or with administration or withdrawal of drugs. What is the cause of bruxism? The exact cause of significant bruxism is unknown, although most explanations center around local, systemic and psychological reasons. So, the local theory suggests that bruxism is a reaction to an occlusal interference or a high restoration or some initiating dental condition. And systemic factors suggested include maybe due to because of the intestinal parasites or subclinical nutritional deficiencies, allergies or any other endocrine disorders. And the psychological theory says that bruxism is a manifestation of a personality disorder or due to the increased stress. Children with musculoskeletal disorder like cerebral palsy and severely mentally retarded children commonly grind their teeth. These patients' bruxism is a result of their underlying physical and mental condition. So these are the etiology behind the bruxism. The clinical features. 1. It will present with occlusal trauma, especially tooth mobility, which may be especially seen during the mornings. Prolonged bruxism may predispose to gingivitis also, which can result in periodontal disease and alveolar bone loss. Then tooth structure, there will be occlusal wear seen. It is nothing but atypical facets, which is shiny, uneven occlusal wear with sharp edges, abrasion on incisal edges of upper and lower incisors. So here this is called the occlusal wear facet. Excessive wear can lead to increased sensitivity because there is already exposure of the dentin, and pulpal exposure may lead to formation of dental abscess. Then other clinical features, muscle tenderness, especially on palpation, can be seen, which involves lateral pterygoid and the masseter muscle. Muscle fatigue on waking may be seen. Also hypertrophy of masseter muscle unilaterally or bilaterally. And the most commonly involved muscle is the lateral pterygoid followed by medial pterygoid and masseter. Then other clinical features, TMJ disturbance and pain. Pain will be usually dull and unilateral. Then you can also ask for the morning pain, that is a pain present during waking up. Then crepitation and clicking within joint, restriction of mandibular movement and jaw deviations may also be observed. They can also present with headache, which is chronic type due to the muscular contraction, and sounds of grinding and tapping, soft tissue trauma, small ulcers or ridging on the buccal mucosa opposite the molar teeth. So these are the clinical features.